Hi, Paediatrician Squad. Welcome back. Today we talk about Group B streptococcus vaccine. I guess not many of you have heard of the concept of Group B strep vaccine. Most of the time we heard of Intrapartum antibiotics. But then, good news is the vaccine is coming. So in this video, I will guide you through where are we now in the development of the Group B streptococcus vaccine. And I guess few years later, we may have this kind of vaccine to change our clinical practice. So let's get started to know where are we now. So first of all, as all of us know, Group B streptococcus can be severe. Okay, it caused more than 9,000 infants' death in 2020 in the whole world, and around 37,000 of children had the neurological impairment or developmental impairment due to the Group B streptococcus, or have the brain damage because of the Group B strep. So it can be quite severe. So in terms of Group B streptococcus, it can affect the newborn in two ways. First is the early onset disease, which is defined from the newborn period from day 0 to day 6 of life. Usually the baby can have sepsis, pneumonia. And also they can have the late onset disease, which is defined the day 7 to within 3 months of life. The baby can suddenly come to your hospital because of having the seizure or decreased GC because they have the meningitis, or it can go into the blood, lead to septicemia and even septic shock or death. So it can be quite severe. Having said that, it's quite common. 70% of pregnant women actually had GBS colonization in their vagina. Therefore, many hospitals have the routine high vaginal swab to make sure the ladies have the Group B strep colonization or not. So how to prevent the Group B streptococcus from affecting the babies? There are a few risk factors. For example, if the pregnant lady had a prolonged leaking during their delivery, the bacteria in the vagina can go into the uterus and affect the baby. So how to prevent Group B streptococcus from affecting the babies? What are we doing to prevent that if we don't have the vaccine? We are giving the intrapartum antibiotics, which means before delivery, the mommy received the intravenous antibiotics, most likely penicillin, in order to prevent the baby from getting the Group B streptococcus. It's proven that it can reduce the early onset disease in the high income countries. So like the pneumonia, the sepsis in the early period, it can prevent. But study shows that it has no impact on the late onset disease, like the meningitis within 3 months. Also, it has no impact in the disease in mother. Sometimes the Group B strep can also affect the mother. It has no impact in the rates of stillbirths and also the preterm births. So it's effective, but then it's not very effective for the intrapartum antibiotics. So there are some scientists thinking whether we can develop GBS vaccine. So there are a little bit disclaimer first. This channel is just for educational purpose only and for sharing only. If you have some questions for your medical problem, do seek help from the medical profession, okay? This is a paper published in Vaccine in 2025. It talks about where are we now in terms of the development of the GBS vaccine. Before everything, we need to know there are two mechanisms for the GBS vaccine. First is the CPS, okay? Secondly is the alpha-like protein. So I will go through one by one. So let's talk about the CPS first, okay? Imagine this sausage is the Group B streptococcus. Okay, it usually wear invisible coat like the Harry Potter, which is called capsular polysaccharide. They have this coat, or we call it CPS. Okay, they wear the CPS to make them invisible. If there are no vaccine, generally, when our body defense system, the white blood cell, it's very difficult for them to find the Group B strep, because they're wearing this CPS invisible coat. It makes the Group B strep quite invisible and also slippery. First of all, they can't find them. If they find them, it's quite difficult to grab them to kill the Group B strep. However, if we have the GBS vaccine targeting the invisible coat or the CPS, it's like helping the white blood cell to wear goggles, okay, so that the invisible coat can show up, and they can find the Group B strep and they can grab it and kill them. Okay, so the CPS vaccine is like having these goggles. This is one of the mechanisms. And there are 10 types of this invisible code. So 10 serotypes for the CPS, 1A, 1B, and 2 to 9. So serotype 3 are the most common one. It causes 60% of all infant disease. So serotype 3, we need to know about this. The second mechanism is the alpha-like protein. Imagine this time the group B strep is the green sausage, okay? In order for them to climb through our body defense system, they need a hook, which is called the alpha-like protein. They need the alpha-like protein to climb over our body defense system to infect us. If there are no vaccine, it's like they use the hook to climb in. But if we have a vaccine targeting the alpha-like protein, it's like the white blood cell will have a magnet, and then they try to absorb all the hook. Okay, no more hook, then the GBS cannot come through our body defense system, and they cannot infect us. Okay, there are 6 alpha-like protein family antigens: alpha C, RIB, and LP1 to 4. 6 antigens. So where are we now? What is the development of these 2 vaccines after knowing the mechanisms? So before we understand where we are now, we need to understand about what are the 4 clinical trial phases. So first of all, in phase 1, usually just after some animal tests to show that it's effective in the animal, then they need approval to test this drug in humans, which is phase 1. So generally in phase 1, we have only small amount of participants, usually a volunteer or even some healthy individuals. They try to test, is it safe to use this drug in human? They try to increase the dose bit by bit to see what are the safe dosage in phase 1. So after phase 1, it shows that, the drug is safe in healthy individuals. It will go to the phase 2, which is generally we use in those patients. We have more people, like 100 to 300 participants, to use the drugs in the real patient. The main purpose is to test what dose is effective. And again, what are the side effects? Is there any significant adverse events that we can't proceed to develop this drug? So after phase 2, then it will go into the phase 3. So it will be a much bigger studies in terms of the scale. So usually it will be the landmark study for showing this drug is effective. Usually it is a randomized control trial, maybe let's say GBS vaccine versus placebo. Is it effective or not? And if there's some good results from the phase 3 trial, then usually the FDA will try to review the drugs, whether it's safe and whether it's effective. They will approve after a phase 3 trial. And then finally, we'll go to the phase 4, which is after FDA approval, the drug is in the market, then we do some post-approval surveillance to see what is the real-world data. Is it really effective out of the randomized control trial setting? In the real market, is it really effective? So it's phase 4. In terms of development of GBS vaccine, we are finishing the phase 2 and going into phase 3. So this table beautifully illustrates the landmark study of the GBS vaccine. So we talk about the CPS vaccine, the invisible code. One highlight is this is one of the study published in New England Journal of Medicine in 2023. It's a randomized control trial and to test whether this group B strep vaccine targeting the CPS is effective or not. It shows that it can have the IgG response to all 6 serotypes of the CPS. And so far it has no safety concerns, which is a very good result. And in terms of the alpha-like protein, the magnet, the hook, again, some very good phase 2 study has been done. It's a trial in 2025. It shows that after the vaccine, majority of the infants whose mother have received the GBS vaccine can achieve the IgG above the threshold of protection, which is quite good. But why not go into the phase 3 trial? There are 2 reasons. First, it's very expensive. Secondly, it's very time consuming. Why I said that? Because in order to prove 80% of vaccine efficacy, we need around 120,000 pregnant ladies, which is the number of the pregnant ladies in the whole London in 1 year. We need large number of patients are willing to join the study. So you can imagine it's very expensive and also it's very time consuming. Are there any alternative way we can go to the phase 3 study so that the vaccine can be marketed? The answer is yes. So instead of counting the number of babies, for example, like when you do a randomized control trial, some ladies receive the GBS vaccine and some are not, a placebo, and then you count the number of babies having the group B streptococcus disease and compare both group and to see whether it's effective or not. Instead of doing that, instead of counting the number of babies, we can measure the antibodies level. For example, again, two groups. One group received GBS vaccine, one group no, and then they try to measure the antibodies level in the babies in both groups and compare them. Okay. But the question is, how high is the antibody level defined as effective? Because some people may say, okay, if the IgG level, just for example, is 100, then it's effective. Some people may say 200 is effective to prevent the disease. We have different definition. So before we go to the phase 3 trial, we need to define what level of antibodies are regarded as effective. This threshold is called serological threshold of risk reduction, or STORR. So if above the STORR, then the vaccine is regarded as effective. There are many definitions for the STORR. So this table shows that different studies showed the threshold of the antibody very different. So we need to define the STORR and then we can go to the phase 3 trial and to prove the vaccine is effective or not. There are two main work ongoing. First, the GASTO and consortium. They're trying to standardize the laboratory assays for defining the STORR. And also there are 3 large-scale sero-epidemiological studies conducted in like South Africa, US, and Europe to define what is the STORR. But even we can do the phase 3 trial, what are challenges ahead? First of all, as you may know, now the pregnant ladies are receiving many different kind of vaccine, like the influenza A, like the COVID. So will there be immune interference with the GBS vaccine? We don't know yet. And even the pregnant lady received the GBS vaccine, can it really reduce the stillbirth and also preterm birth? We don't know yet. Okay. And again, although there are different serotypes in the CPS and also the alpha-like protein, the hook, after giving the vaccine, will some serotypes emerge because the vaccine cannot cover? And it has happened before in the world of the pneumococcus. So we need to watch out for this. So that's the end of the video. There are a few key takeaways I want you to bring home. First, GBS can be very severe, especially when we work in pediatrics. We have witnessed a lot of babies are very ill because of GBS. Secondly, phase 2 trials showed GBS vaccine is actually quite effective. Thirdly, instead of counting the number of patients, we can use the concept of STORR, the threshold of the antibodies level, to prove the group B strep vaccine is effective or not. Phase 3 trial is almost ready to start. So I guess few years later, we may have the approval of the GBS vaccine. But just guess. I don't know. Let's see the development. Let's stay updated. I think this is just a start. This video is just a start. I always think that no video, no AI can replace your own reading. So if you want to have a complete big picture of understanding the topic of GBS vaccine, do check out the description box. I will give you some suggested readings and some references in there. If you want more news or videos like this, especially in the pediatrics, or you are a pediatrician who are interested in joining our pediatric community, do subscribe my channel and do subscribe my newsletter in the description box. I hope to build a community of pediatrics so that we can share our information, share our experience, and to help our children more. So I'll see you in the next video. Bye.